All right, viewers, welcome again. It's another Thursday, and this is the Body Garage, the art of well-being. We would like to invite you, and I'll be your host, Dr. Chepsi. Now, the World Malaria Day has just ended on the 25th of April, and the theme this year has been Time to Deliver Zero Malaria. Innovate, and implement. And different stakeholders met together in Nyamira County to deliberate on the future of achieving a zero malaria Kenya. So today I am joined with a specialist from the National Malaria Program, and he is going to take us through what is this thing all about, malaria. But before that, we would like to start with this one thing. It's a joke. Now, nurses have been accused that they struggle so much to find a line in patients, but a mosquito can find a vein at night with no eyes. Think about that. Karibu Daktari.
Thank you so much.
It's a pleasure to have you.
Thank you.
Before we go on to what has brought us here together, do you just mind introducing yourself to our viewers and what department you work and what basically you do?
Yeah, thank you so much for the opportunity to be with you. My name is Lenson Kariuki. I work with the Division of National Malaria Program within the Ministry of Health. My work is medical entomology. I'm a medical entomologist. This is a field that mainly deals with disease transmitting vectors, specifically mosquitoes. We know mosquitoes transmit quite a number of diseases. Apart from malaria, the other diseases they transmit. So my work mainly entails going to the field, correcting these mosquitoes, understanding their behavior so that I can inform the best policies in terms of prevention.
Yeah, wow. You said mosquitoes do not transmit malaria only, any other disease?
Yes, they transmit quite a number of other diseases. For example, we have what we call arboviruses. We talk of dengue fever. It's a viral disease. You talk of chikungunya, which is mainly found in the coastal area and northeastern area. It's also transmitted by mosquitoes. Talk of what people normally call elephantiasis, mainly found in the coastal area. It's also transmitted by mosquitoes. We had some few years about Zika virus, which is also transmitted by mosquitoes. You've heard about yellow fever. It's also a disease transmitted by mosquitoes.
All right. So let's narrow down and talk about this mosquito that specifically transmits malaria.
Yes.
What kind of mosquito is this?
Yeah, generally there are three types of mosquitoes that we know. We have what we call Anopheles mosquitoes. We have Culex mosquito, and we have Aedes mosquito. The one that transmits malaria is Anopheles mosquito. Within the Anopheles mosquito, we have different species or different what I can call brothers and sisters of that mosquito. Specifically in Kenya, we have two types that transmit malaria. We have what we call Anopheles gambi and Anopheles funestus. Yeah, those are the two main ones.
Quite some tough.
It's tough. It's a mouth, but those are the two main ones that transmit malaria in Kenya.
So, where do we find this mosquito? You said the female Anopheles mosquito.
Yes,
is the one that transmits malaria primarily.
Yes.
All right. So where do we find them?
So in terms of where we find it, it all depends with where the mosquito breeds. Anopheles mosquito, especially the two that I've mentioned in the country, Gambi and Funestus, they mainly breed in rural areas in stagnant water. This is water that mainly, especially when it rains, we see a lot of service runoff. This mosquito, you prefer breeding there. Again, where we have rice paddies, you find this mosquito breeding there. You may also find it breeding in streams, in swamps. So it's quite a range of breeding habitats where you are likely to get it, but you'll find it mainly in rural areas where water is not organically polluted. That's why in urban setups, it's very hard to get Anopheles mosquito, and that's why we don't have malaria transmission in urban setups. Because the waters in urban setups are highly polluted, and this mosquito will not prefer to breed.
They prefer fresh
They
water.
prefer fresh water.
Okay. All right. So just on the side, you said specifically female and
Anopheles
mosquito.
mosquito, yes.
Can you differentiate them when you say? I mean,
Yes,
when a mosquito flies into my house.
It's very possible to differentiate them.
Yeah.
Basically, what we do actually in this lab, part of the work that we do is to differentiate these types of mosquitoes. For example, for a male mosquito, it usually has a lot of brushes or hairs around the mouth part, just like the way men and male usually have a lot of beards. It's the same thing with the mosquitoes. It's quite interesting to see them even when they are landing on the wall. But females, they do not have those hair on the mouth parts. So it's very easy to identify them.
Any difference in terms of the noise they make?
Well, there is no major difference, but there are hypotheses that wherever you hear that noise, it is the males that are dancing on your heads, and the female are watching at a distance, trying to see which males dances the best so that they can mate. But that is an hypothesis.
All right. Which regions in Kenya are commonly affected by malaria?
Yes, so in terms of malaria, in Kenya, malaria is what we call heterogeneous. It's not distributed evenly. You find the areas where malaria burden is high and the areas where malaria burden is low. The areas where malaria burden comes after some time outbreaks. So the regions that are most affected by malaria are mainly within the Lake Victoria region. That is Western Kenya and Nyanza, the former two provinces. And then also coastal region is also affected by malaria, but areas within the central region of the country, you not find malaria burden being very high. Areas within the arid and semi-arid, the northeastern, malaria burden depends on availability of rainfall. But the burden is very high in Lake Endemic Zone and within the Western and Nyanza region.
So people from Kisumu?
People from Kisumu, talk of Migori, Siaya, Busia, Kakamega, Vihiga, Bungoma, Homa Bay, those ones are highly affected by malaria compared to the others in the country.
All right. So what are some of the things that happen, like practices that happen in those rural areas that, yes, naturally malaria can be found there, but again it increases the prevalence? Well,
I may tie this to the transmission cycle of malaria. You find that, as I've mentioned, mosquitoes breed in water habitats. We know those regions, number one, there are things we don't have control over, especially the environmental factors. The temperatures are high in those regions naturally, which we don't have control over. And there is also rainfall, which falls and we don't have control over. But the other human-related activities which people practice, for example, in Kisii and Kakamega, we know Kakamega, they do a lot of gold mining, especially in areas around the Koromani. So you find those areas where they dig and leave those open pits, water accumulates there, and there's a lot of breeding of mosquitoes that transmit malaria. Again, in areas like Kisii and some parts of Nyanza, where they are doing a lot of brick making, they leave those areas open. When water accumulates there, malaria transmission goes up. Additionally, there are some interventions which we usually implement there. For example, we give those people around those areas free nets. But now
we can hold on the interventions at the moment, because we'll come to that later. Any difference in the transmission rates within those regions during, let's say, the planting seasons when it's green all over, like maize and everything that can grow on the farm, as opposed to during harvesting when the lands are cleared?
Well, we usually experience peak malaria transmission, especially in May, June, immediately after the rains.
Yeah.
Simply because there are water habitats for mosquitoes to breed.
Yeah.
In terms of plantation, it doesn't contribute much. We know that a mosquito can feeds usually on plant juices to get energy to fly, but it feeds on blood so that it can develop its eggs. So plantations, as long as they are there, they'll sustain mosquitoes in terms of energy.
Yeah.
But mainly it depends with the water habitats that are there. And that's why after the wrong lanes, which we are experiencing now, we might get a lot of cases in May and June. Then we might experience more cases in November and December. Yeah.
All right. Does the kind of house somebody lives in determine whether they are likely to be infected with malaria or not?
Yes. It's a factor that determines, it's a risk factor actually. We know that the type of houses that we have, especially in the rural areas, I mean, we may not call them very modernized houses, in the sense that they have what we call eaves, and they don't screen those houses, so mosquitoes can access the house very easily. So the type of a house to some extent has a contribution towards the risk of exposure to malaria. Yeah.
All right. Let's move on to who are the most at risk groups to get malaria. I mean, everybody can, but who is most likely to get?
Well, the two main groups that are affected by malaria are children and pregnant women. For children, we know that the immunity is still developing. They are naive, and due to this, any attack by malaria will be detrimental. For pregnant women, we know wherever the hormones changes because of pregnancy, the immunity also goes down. So that's why you find the two groups are the most vulnerable in terms of malaria effects. Yeah.
What about the elderly? Are they prone to malaria as well?
Well, I may not say they are so much prone, because, you know, the more episodes of malaria you get, the more you develop some immunity to it. So this immunity, we know over time it wanes, but yes, they can be, but the population that research has shown is at risk is mainly pregnant women and children.
Yeah. All right. Allow me to ask this, because these are the questions that people ask. What about the people who live in crowded places? Let's say refugees or internally displaced persons.
Well, when we are talking about vulnerable population, this is part of the group, that crowding. If one person has malaria in such crowding, especially also in slums and in holding camps for immigrants, we know that if there is a mosquito that is around there, especially anopheles, and it bites one person, the spread can be extreme. So we usually categorize them as well as a vulnerable population. Again, it has to do with the interventions that are being directed there, because if we have the right interventions, then we may not have extreme spread of malaria in such crowded places, but they are part of the vulnerable population.
All right.
Yeah.
So let me ask, is there any relationship between malaria and HIV/AIDS?
Well, the relationship may exist as a result of low immunity. So that's the only relationship that they may have. Because HIV is viral, and malaria is a parasite-caused disease. But if one has HIV, we know that the immunity is down. So if a parasite comes in, especially malaria, then it can bring those people even to the worst. So that's the main relationship.
All right.
Yeah.
Any particular specific case of malaria that you found that was quite interesting that you'd like to share?
Well, I may not say an exact one, but I may point at what we call severe malaria, which can even result to cerebral shutdown. So those cases are there. They happen, especially for people who mainly don't have immunity to the disease. People in the low risk regions like Central, if you visit an area where malaria burden is high and you happen to pick a parasite from there, it can even result to a very severe case that has to be treated within the ICU unit because they don't have immunity. So there are severe cases that exist which normally results to cerebral, even cerebral malaria.
Okay.
Yeah.
Thank you. I think we're going to pause there, so we are going to take the break. When we are back, we will talk about the common symptoms that malaria present with. So stay tuned. Bit about the symptoms of malaria. My name is Dr. Chepsey and I'm your host. So, Dr. Lenson, you have told us about a bit previously about cerebral malaria. Let's talk about generally, if somebody gets malaria, how are they going to feel?
Yeah, thank you. So in terms of symptoms of malaria or how malaria presents itself, mainly, number one, it's fever. One may experience chills. The other symptoms include body weakness. You may experience pain in your muscles, pain in your bones, and the common one is flu-like symptoms, and that's why we used to confuse malaria with COVID. And during that time, we experienced a lot of problems because people felt that if I have flu-like symptoms, it might be COVID, and I don't want to go to the hospital because if I go there, they are going to put me in the isolation camp. So those are the main symptoms of malaria that you are likely to experience. And once you have these symptoms, you are supposed to go to the hospital. Don't go to the chemist and purchase over-the-counter drugs. Just go to the hospital, get tested, and if you turn positive for malaria, then you'll be given the right medication.
Yeah. All right, got it. Somebody asked about what you talked about, the malaria that affects the brain.
Yeah.
Yes. Will you talk about that a little bit more?
Yes. So this is the severest form of malaria, and it presents in many ways. And I've heard about hallucinations. One becomes unconscious. It even can result to anemia in the body. And the good thing with this form of malaria, we have treatment for it. So the type of treatment that we give such patient is different from the one we give the uncomplicated type. So this one, we categorize it as complicated malaria.
Yeah. All right. Okay. So let's talk about like what happens from the mosquito to the human body. How does it happen until that malaria is transferred? We are talking about the life cycle.
Okay. So what happens in terms of the life cycle? I talked about mosquito feeding on human beings. And the reason they feed on human beings is not to get food for their body, but it's the female that wants to get blood and to use that blood to develop its eggs. So when it is feeding on human beings, if the person happens to be carrying the malaria parasite, the mosquito will pick that parasite in the process of feeding, and that parasite is in form of what we call gametocytes. So these gametocytes will move into the mosquitoes, and depending on temperatures, those form of parasites within the mosquito will develop within a period of about 9 to 11 days. If the temperatures are very high, it can even take 9 days. So after the 9 to 11 days, this parasite within the mosquito, after development, will move to the mouth part of the mosquito to a form which we call sporozoids. And when the mosquito will go, or when it will be biting the next person, it will reject this form of the sporozoids to the body of that new person it is feeding on. And these parasites will move through the bloodstream of the body, move to the red blood cells, move to the liver, mature to some stages, and this is the time once they are in the liver, they start now bursting the liver cells. They'll be released into the body stream. And this is when the time a person starts experiencing now the symptoms, because the cells are bursting. The parasite is releasing some chemicals in the body, which is interfering with the physiological status of the body. So after some time, these parasites...
Just a minute.
Yeah.
So from the time the mosquito bites the person and introduces the parasite to the time it's getting to the liver and it's now starting to make symptoms, how many days?
It takes about 14 days, 2 weeks.
2 weeks?
Yeah, from the time you are bitten. That's why you usually say if you visit an area with the burden of malaria, where the malaria prevalence is high, and you come here, we expect if you got infected, it is after about 14 days. Normally when a person goes to the hospital, they asked, did you travel, do you have a history of travel for the last maybe 14 days? This way the clinician will be able to judge whether you can be tested for malaria or not.
All right. Please proceed. Now from in the liver.
So once these cells have been released to the body stream, the male and the female cells, because they are both, they'll mate again within the body, and then they'll move to the bloodstream, and they become now gametocytes again, and they are ready to be picked by mosquito again to continue the transmission.
So if one person in a concentrated place has malaria,
yes,
and a mosquito bites that person, so it can transmit now to other people?
To other people, so many of them. You can imagine a mosquito lays about 100 eggs. And then these 100 mosquitoes emerge. And you see, the fact that one mosquito bit you and you are carrying malaria does not mean that another one will not come and bite you. So you can imagine you have like 10 mosquitoes biting a person who has malaria, then they move out, they'll spread that malaria to about another 10 people. So that's where the issue of crowding comes in, and this is where the issue of reducing now the mosquito density comes in, the issue of treatment, because if that person was treated, you can imagine the number of people you'll have prevented from getting malaria.
Okay, sounds good. Now let's talk about the prevention strategies. You know, at the national level where you are, what are some of the strategies that are in place to help mitigate, as the theme of this year is actually to deliver zero malaria Kenya. So what is happening on the ground?
Yes, so in terms of the strategies that we have quite a number of strategies that we implement. Let me start with the main one, which we usually call vector control strategies. When we talk about vector control strategies, these are preventive interventions that are preventing, number one, mosquito from biting human beings. So they are creating a barrier between the mosquito bite and the human being. For example, we usually distribute nets in 27 counties where malaria burden is high. We distribute these nets after every 3 years. Then we also distribute nets to pregnant women and children under 1. You remember earlier I talked about the vulnerable population and groups. So we distribute these nets in a routine way through the antenatal clinics to pregnant women and child welfare clinics to children under 1 year. Then we have another intervention we call indoor residue spraying. This intervention entails spraying a household with an insecticide that has a residue effect of about 6 to 9 months. So if your house is sprayed with this insecticide, you are likely to be protected from mosquito bites for about 6 to 9 months. This intervention, we don't implement it everywhere in the country, but we implement it in areas where malaria burden is high, especially Migori and Homa Bay. We have another intervention we call larval source management.
Before you proceed, these two that you've mentioned, the mosquito nets and the spray, are they free?
Yes, we do this for free, and I've mentioned not everywhere in the country.
Yeah.
The nets, we do them in 27 counties for free. For Migori and Homa Bay, spraying, we do it for free. Yeah, so we don't charge.
It's a tailored approach.
Yes. So we have the other intervention which we call larval source management. As you know that, and as I talked about this area, these mosquitoes breed in water. So larval source management entails killing or destroying these mosquitoes when they are still in water so that they cannot emerge into adults. This intervention, we are implementing it in 8 counties within the Nyanza, 4 within Nyanza and 4 within Western region, because that is where the burden is very high. Again, this one is for free, and we are being supported technically by the Cuban government. You remember there was a bilateral agreement that was signed by the government with Cuba. Part of that agreement was to bring those experts to guide in implementation of this intervention. We have other interventions like case management, whereby we offer free testing of malaria in health facility, when government health facilities, especially when one presents with symptoms of malaria. And we also treat malaria in government facilities for free. So that is under a strategy we call case management. We have another strategy that you try called socio-behavioral communication, SBC. This intervention helps in communicating to the public that we have given you the interventions, please use them. So it helps in uptake of this intervention. We do this through media, both print and electronic. We also utilize social media as well. So those are the main strategies that we have in place.
What are some of the things that a person can be doing in their own homes to help in line with these prevention strategies that you've said?
Yeah, there are quite a number, because number one, I might achieve 100% coverage with nets. But does it mean that you're using that net? We have a story of one person who mentioned that if they knew how to use the net, or if they used the net as indicated, they would not have gotten some of the problems they got with malaria. I don't want to mention them by name. So the point is, I've given you a net, but are you using this net? So some of the things that you can do at a personal level is uptake of these interventions. And that's why we are talking about the theme that we have currently. It's time to deliver. So ownership. You need to own this and also take part in uptake of these interventions. The other thing is, if you have water bodies within your environment, some which you've dug because of the human activities that goes on, please try and cover these water bodies so that mosquitoes cannot breed there. The other things are the behavior, our behavior. For example, staying late at night, outside. Mosquitoes will still bite you if you have to. There are some personal protective measures that you can take. For example, wearing long sleeved clothing. For example, application of repellents, which are
That's the other question I wanted to ask. Do they work?
They work very well.
Okay.
So these are some of the measures that you can take at a personal
so the repellent creams?
Yeah, creams.
The coils?
The coils, vaporizers. Even those long sleeved. In coast, they are even screening their houses with nets, the windows. They are doing very well. These are some of the measures that you can take.
All right. If I live in a malaria endemic area, one person sleeps early, like let's say 7:30, 8 p.m., and another one sleeps late, like 10 p.m. Is the one sleeping late more likely to get malaria?
Well, right now we've seen that the mosquito vectors or the malaria vectors are biting early during the night, early in the evening, and even late after morning. Before, these mosquito vectors, they used to bite around 10 to 12.
Yeah.
Then there used to be another peak from 3 a.m. to about 4 a.m. But because of change in behavior, they are now even biting earlier. So now the question is, at 10, you are sleeping. You are protected by, you are sleeping under a net.
Yeah.
At 7 a.m., you may be seated at the table room or outside, you know, talking and all those things.
Yeah.
But you are not under any protective measure.
Yeah.
That's why we are encouraging, during that period, try to practice personal protective measures.
Right.
So the exposure for a person who is sleeping late at 10, the risk might be lower because they are under a protective measure. But those ones below 10, because they are not under any protective measure, they are at a higher risk. Yeah.
All right. Let's talk about the malaria vaccine. Where are we? There has been a recent excitement in the research field about the development of the malaria vaccines. There's still not so much clarity whether it's ready for use, its effectiveness. Where are we?
Yeah, in terms of malaria vaccine.
Now we pick on to discuss about the malaria vaccine. Yes, doctor. So we've heard about the malaria vaccine and we're not sure exactly at what stage we are.
Thank you. Malaria vaccine, I think we've come a long way in terms of its development. This is one of the malaria vaccines that has been developed called LTSS. This vaccine, we know it is efficacious. Trials were made, but where we are at the moment, Kenya, Ghana, and Malawi, they did a pilot last year and the previous year in terms of administering this vaccine in a large scale to children. And in Kenya, we managed to vaccinate about 400,000 children. And this has been shown to reduce the number of malaria cases or admissions in hospitals. This vaccine has been shown that if you vaccinate about 200 children, you are saving one life. So the issue here is about coverage. If you have a larger coverage of vaccination or in a vaccination program, you are likely to reduce malaria burden and even mortality in children. Yeah. So where we are at the moment, we are looking at now how we are going to scale it up to the entire of high burden counties. Of course, there are funding issues, there are finances that we are looking at, so that now this can be scaled up to the high burden areas. But the vaccine is working very well.
Oh, wonderful. All right, let's talk about the new species of mosquito that recently has been released by, I think, the KEMRI, the Kenya Medical Research Institute.
Yeah.
Tell us about that.
So in December 2022, during our usual routine mosquito surveillance, we detected one of the newest species of mosquito Anopheles that has invaded Africa. This mosquito invaded Djibouti first from maybe from the Red Sea movement within the Red Sea. Yeah. And it also invaded Ethiopia, then Somalia, then Sudan, Nigeria, then Kenya, and now we have Ghana. So these are mosquito that transmits malaria in Asian countries. And why it's a major concern to us in the country is because these are mosquito that breeds in containers. Anopheles stephensii breeds in containers. As I alluded earlier, the mosquitoes that we have that transmit malaria in Kenya, they are mainly in the rural areas, and they prefer breeding in water within the surface. But this is a mosquito that now breeds in containers. So where you are likely to get these containers is mainly in urban setups. They may be in the houses or discarded containers outside due to pollution. So this mosquito will happen to breed there. And since we don't have malaria in urban setups, so we are likely now to start experiencing malaria in urban setups due to this. Again, this is a mosquito that is adaptive. It can adapt to any changes in environmental condition, and it is invasive. It spreads very fast, and reports that we are gathering from other countries is that it's almost resistant to the insecticides that we are using. So it means we'll have to change tact in the way we control this mosquito. So we are still working as a country with partners to do a lot of surveillance activities to understand the extent, and also working on the control measures, especially health education on how to discard those containers, and also if you don't have to discard them, then you can cover your water to ensure that mosquitoes don't breed them.
Okay. So it's now for the city dwellers to be aware of this and be on the alert. Let's talk about the World Malaria Day 2023, all right, which it's already happened. The theme is time to deliver zero malaria, invest, innovate, and implement. So in summary, what are the key highlights for this campaign?
So the main key highlights for this campaign, number one, is to highlight the need for continued commitment, investment in terms of the finances and in terms of capacity that we have for malaria, and also political commitment. If we don't have political commitment and political goodwill, we may not be able to achieve so much in terms of malaria control. Again, the other thing is the creation of awareness, to tell people that malaria is still killer disease, and as much as it is a killer disease, we have preventive measures that if people can uptake these measures that are given or that are implemented by the government, then we'll be able to reduce malaria to a zero case.
All right. So those are the key highlights.
Those are the
What is the role of youth in this campaign?
The role of youth in terms of this campaign is quite enormous, ranging from creating awareness through different channels. I'm looking for the day when TikTokers will also start talking about malaria control. We have somebody talking about malaria control, interventions and uptake in the TikTok. So we can use social media. We have social media, even whatever that can be used by the youth to discuss about malaria and create awareness. They should also be involved as role models, in areas where malaria burden is high. I mean, let the utilization of that net start with the youth in that household, and also campaigning and being involved in malaria control activities within the society. So we have a very big
and since most youth are on social media,
that is a very good platform that we can use.
All right. So is there any relationship with two things, the COVID-19 pandemic that just ended 2021 and climate change?
In terms of the COVID-19 that ended, we know it has disrupted almost all the health delivery systems. In terms of malaria, we have we end a challenge because that time it came when we were about to distribute mosquito nets to the communities, and COVID-19 really affected our implementation plan. Again, in terms of hospital visits, due to malaria, we experienced not many people, as I said earlier on, were going to the hospitals. So this had an impact, and also the global supply chain in terms of commodities, because we know all efforts were geared towards manufacturing COVID-related items. So this also affected. In terms of climate change, yes, global warming and other changes in climatic conditions have an impact. We know that when temperatures rise, especially in highland areas, in highland areas we usually have water is available almost all the times. But if you change temperature a little bit, this leads to upsurges of malaria. In arid areas, the temperatures are there, but we don't have the water. So if there are changes in terms of precipitation and there is water there due to climatic changes, then you are likely to experience malaria upsurges. So they have an effect.
All right.
Yeah.
Wow. Thank you so much. I think we've come to the close of our discussion. Dr. Lenson is going to take us around his laboratory. This is the National Malaria Control Center, and we are in his office. So join us as we explore his workplace a little bit more. Thank you.
Welcome to the Malaria Mosquito Laboratory, which is housed under the National Malaria, the National Public Health Laboratories, and this lab is within vector-borne diseases laboratories. In this lab, we usually analyze malaria transmitting mosquitoes to understand which species are present in the country and whether they are carrying the malaria parasites. So basically what happens in the field, we correct mosquito using this gadget. It's called a light trap. We set it in the houses, indoors and outdoors. And once the mosquitoes are corrected, it has a lamp here, a bulb, and it has a van that rotates to pull mosquitoes inside. Insects are attracted to light. So when they come in here, they are pulled by the fan and they get in here. And so we close this part. And these mosquitoes, we take them to the laboratory. And once we get to the laboratory, we usually put them under dissecting microscopes. As you can see, these are mosquitoes which are there. And within here, we are able to identify and tell whether the mosquitoes that we have are the ones that transmit malaria or not. Now, for us to understand which exact species that we have, we usually subject them further to more analysis, and we usually put them in these tubes, and we prepare this in what we call a PCR work stations. Once we have prepared them from here, then we put them under what we call a PCR machine, and this machine will help us know which specific species that we have in the country. So the results that we get there from here, we usually subject them to a reader, and that reader now will help us know whether we have which species of mosquitoes where in the country. Yeah.
So what happens after you're done with the mosquitoes?
So after we are done with the mosquitoes, we store them for future. We have an archive down here whereby we pin those mosquitoes and name them by their species and the place and the year where they were corrected. So we keep a storage of them, and this is for any future reference. Yeah.
All right. Okay, I think we've come to the close. Before we go off air, your parting shots to the people of Kenya about malaria.
Yeah, thank you so much. My parting shot is that we have a responsibility, we have a personal responsibility to take up the malaria control measures in the country, and this is the only way we will be able to eliminate malaria in Kenya. Let's not look at it in terms that of it is the only government that should control malaria, but we also have a personal responsibility in terms of prevention and control of malaria in Kenya.
Thank you so much, Dr. Kariuki. It's been a pleasure to have you on the show. We appreciate your time and your knowledge. All right, we have come to the close of our show today.